Hello, everyone. Gonna give a few minutes, see if anybody wants to pop on and be involved in the discussion. Otherwise, I will just do all the talking. I got a very, very important subject today that's been on my mind. I've been seeing it a lot and learning more and more about how systemically it affects us fully. Hello, my sweet niece. But, a lot of us don't realize how the way we breathe can affect our overall health. So a lot of those questions I was asking you guys were helping me to understand what kind of things you guys might be dealing with. Hello, Michelle. So I'll give it a couple minutes. Hope everybody's doing well. And I'm going to talk to you about some really important stuff here. And I've got a lot of notes because there's a lot of details that I may or may not want to refer to. So, Miss Michelle. So, and I'm going to pull up the results here too about where everybody fell on here. So, okay. A lot of people are dealing with this chronic fatigue. You're not able to, like snoring, not sleeping well. Hello, Laura. Some of the highest on the radar came. Highest on the poll was waking up unrested. Okay, and then clenching teeth and struggling to relax were pretty high up there too. And then a lot of you fell into the snoring. Here's the thing. All of these things are connected. Every one of these problems, every one of these issues on this poll are all lead to one substantial problem. Okay, so there is a significant difference in breathing through your mouth and breathing through your nose. Okay, during the day, at night. And I'm telling you, mouth breathing is a big, major issue in this world. We don't realize how sick it makes us. We don't realize how many things are tied into that. And so I'm going to talk to you about some of those details, some of those things that I had, the clenching, the teeth, having chronic teeth problems, high blood pressure, the dry mouth, like all of these things are clues that you are having a problem with good, normal nasal breathing. Okay, and so what I'm going to say to you, hello, there's my cousin. Hello, Amanda. What I want to say to you is, I'm going to reiterate this several times. If you feel like this is talking to you, if you feel like you have a hard time breathing fully through your nose, and you rely on breathing through your mouth during the day, if you're doing it during the day, you are certainly doing it during the night. If you feel like this is it's a problem, you've got to get figured out. You need to figure out why you're having a problem. I'm going to give you some things you can maybe work on, but this is an important thing. Okay. So I need you to take it seriously. All right. So I'm going to get into some of the details. All right. One of the biggest thing to realize is that we're not supposed to be, we're not meant to be breathing with our mouth. Okay. Mouths are made for ingestion, for eating, talking, speech, right? And it's a backup. It's a backup for when there is a severe obstruction of your nose. Okay? So our anatomy and our physiology is not set up to be breathing through our mouth. Okay? And when we breathe through our mouth, there's a lot of things that can happen. First of all, the air is drier. You're not getting enough humidity into your lungs, okay, which gives us some of those chronic problems with dryness and come along with that. If you're breathing through your mouth, hey, Melinda, when we breathe through our mouths, it also, what it does is it requires our jaw to kind of sit back. So when we breathe in, when we breathe through our mouth, the jaw sits back a little bit. Well, actually that closes back that airway a little bit on its own. And so then we bring our necks forward in order to make up for that. Okay. So forward head posture, jaw position. I'm going to keep referring to my notes because there's a lot of things here. It's when we mouth breathe, it's meant to be short term. Like when we're really, really, really like maybe in a max sprint, right? A max workout when our noses are plugged up. Okay. But we're not supposed to be doing this chronically. It is a significant cause. It is one of the main causes of waking up tired. Okay, so if you're waking up tired, I want you to start thinking about some of these things I'm telling you to see if maybe your problem is that you're not really good at breathing in fully through your nose. Okay? Let me see some of the other things here that I talked about. So some other problems with breathing in. Any questions? Let me make sure I can see. Dun dun. Am I seeing comments? I see that you guys are there. I see you guys are there. Okay. Hopefully I'm not missing comments. All right, so other things that happen when we breathe primarily through our mouths, okay? We will develop, especially this is important for those of you with children. If this is happening, hello Ginger. If this is happening in a child that you see, if you see a child that is keeping their mouth open when they're sleeping or when they're playing or when they're just sitting around, you need to figure that out quickly, okay? It's going to develop you're going to develop oral problems like bite and dental problems and the shape of their jaw and their mouth, not to mention some of these systemic things that you're going to hear that they're missing out of nasal breathing, okay? So there's no reason, children don't have any, they haven't had any other, lived life long enough to really have many reasons to be doing that. There's something going on. Not to be scary, but you want to try to figure this out, okay? It's not just they happen to keep their mouth open. No, there's some that needs to be addressed, okay? So affecting your teeth and your bite, you may have a hard time with dealing with when you have braces and maybe things keep moving back. You have recurring dental problems. You might get these looser lips, okay, and like lazy lips, bad breath. Those are also things that can be signs that you are breathing through your mouth predominantly. And if anybody has a question that's like, "Ooh, what about this?" or "I think I do this," please interrupt me. Let me see. Oh, noisy eaters. How many of you guys know noisy eaters? I know a handful. I may even be one sometimes, but those are all signs that you're breathing through your mouth way too much. Okay. Hello, Sophie. Another cause, what it will also do is start to create this enlargement of your tonsils, right? That's going to make it even harder for you to get air in through your nose, right? So this is a really bad cycle to be in, okay? It can affect your immunity, right? I think part of that's because of the humidity that you're not getting and the fact that you're not filtering things through your nose. Dental disease can cause deformity, okay, of the facial structure. Starves your mitochondria. Okay, this is coming from a guy, Dr. Lin. I can give you his references because he's got a lot of good stuff on this. Starves your mitochondria and ultimately shrinks the brain. Okay, so this is not a good thing. All right, so let's talk about why breathing through the nose is so important. Okay, just again making sure nobody's trying to speak to me. Hang on a sec. So breathing through the nose. Now, there's a couple of things that you guys are going to learn here about breathing. I just want to make sure that I'm not missing anybody. Dun, dun, dun. Okay, so nasal breathing is really cool. So I learned something recently that's really cool about the nose. But first of all, think about this. It's like a filter, right? It's like a filter for all of the allergens, the viruses, the bacteria that we breathe, right? So of course we should be breathing in through our nose. That's our filtration system, okay? So that is the way we are intended to breathe with, is our nose. Okay, another thing, so then you get nice moist air into those lungs, all right? I'm going to talk a little bit more about this. This is the cool thing. It facilitates the absorption of nitric oxide. Okay, and some of you may have actually been hearing that there's a lot of talk about nitric oxide, and there's some supplements even out there on trying to help us increase our nitric oxide. We have tons of it in our nasal passages. Okay, so I'm going to talk a little bit more about that and show you a nice picture. But continuing on to why our nose is so good for breathing, what it is that makes it so much better than our mouth. Again, it doesn't, you can maintain an appropriate jaw position when your lips are sealed, okay, and you're not letting your mouth drop open. Regulates, so we breathe slower. Okay, breathe slower when we breathe in through our nose. Slow, deep, full breathing is what we are intended to do, and I'm going to explain that a little bit when I talk about carbon dioxide in a second. Okay, it allows us to keep our tongue, we're going to talk about tongue position, on the roof of our mouth. Okay, when your mouth is open, we tend to let that tongue dive down with it, hang down with it. Tongue position on the roof of the mouth is huge for airway, for jaw alignment, for a lot of these things that we've been talking about. Okay, more to come on that. Hello, Joyce. You missed it. We were talking about mouth breathing, okay, and how it's like such a major problem. I don't want to go to as far as saying it's killing everyone, but there is a big mass. There's a lot of things that are linked to mouth breathing that we are learning more and more about. And so now I'm talking about what's so good about the nose. Okay, and it will reduce your chances of snoring. Okay, another thing is that it promotes activity of your parasympathetic nervous system. When we breathe in through our nose, it helps us because of that slow breathing, and because of this nitric oxide. In a minute, I'm going to tell you more about. We are able to tap into our fight or flight. Right. So why are we not waking up rested? Why are we not getting as much sleep? Could be because we're missing out on that parasympathetic response that we get from breathing in through our nose. Okay, calms and relaxes the body. We can get the idea of the opposite of fight or flight that will create. Okay, so on the flip side, mouth breathing is made for those kind of things. We're running away from something. We need fast, quick air, right? It's a fight or flight stimulus, whether you're actually fleeing or you're trying to sleep. That's what's happening in your body, okay? Let's see, promotes digestion, right? Let's not forget, digestion is on that parasympathetic phase. We have digestive issues. It could also be a parasympathetic issue, okay? Not able to tap into that parasympathetic chain. There are some other things that, like I said, that I didn't put on here, like bad breath. I didn't want to embarrass anybody. Bad breath is linked to it. ED, okay, little erectile dysfunction, that's linked to it. Didn't want to make you guys answer those questions, but those are all signs. If you have multiple of these things, if you answered yes to a lot of those, you really need to be trying to take this seriously, okay? All right, so nitric oxide, okay, is really cool. It's all, this is what I did not realize, and I've been learning this recently, guys. I belong to it's called Airway Focused Georgia. So I have access to a lot of airway specialists, okay? They found me because I work a lot with breathing and lungs, and so we work together a lot. I'm learning a lot from them, and this is one of the cool things I learned. So nitric oxide, okay, first of all, where'd it go? Hold on, I had all these notes, but they're getting all mixed up. Okay, nitric oxide is required in our bloodstream, required in our bodies to help keep our blood vessels open. Okay, so this is where we can talk about nasal breathing actually creating cardiology problems, blood pressure problems, heart problems, circulatory problems, systemic problems. If we're not getting that nitric oxide through our nose, this is why we're designed to breathe through our nose. It's a beautiful design. You've got to use it. Okay, so what it does is it signals your cells of your arteries to relax and open, decreasing your blood pressure. Okay, there are even studies linking this nitric oxide to some antiviral, antifungal, antibacterial, okay, properties, which is another reason why nose breathing is so much better for your immunity and your health, where mouth breathing is not. Nitrates also play a large role in your metabolic system, okay? And there are some places, I'm sure Miss Melinda and some others of you on here have probably heard about this nitric oxide, and it is found in vegetables, primarily beets, okay? So we can eat it, we can get it in some food, okay? But we have our source right here as well, so why not be bolstering it in every way that we can, okay? How many breaths do we take in a day, right? the best way to access this nitric oxide is to breathe slowly through the nose, okay? Breathing fast will causes those blood vessels to restrict, okay? Catching the theme here. But this is a cool picture. Let's see if I can get it. It's backwards for you guys, but it doesn't really matter. That is a picture depicting a blood vessel, okay? And so when we have the presence of 100% nitric oxide, we're getting all the nitric oxide we need on a daily basis, okay? This is what your arteries will look like. As we go on and we decrease the amount of nitric oxygen that we are receiving in our systems, okay, triggering into these cells, we start to narrow and we start to build up plaque, okay, all the not good things that we want in our arteries, okay? So that's a really cool thing. Right here in your nose, you've got nitric oxide sources. All you got to do is tap into them, okay? Everybody good? Whoops. Everybody good? Okay. All right, I'll keep talking. Jump in if you need to. And I've done this before where I got all like convinced that nobody was talking to me and I was missing it. Okay. One more thing to cover, and then I'm going to talk to you about like what should you try to do about this, okay? So the other thing to understand is about carbon dioxide, okay? There is some misunderstanding about carbon dioxide. So, all right, so when it's not just a waste gas, right? We think, oh, we oxygen in, we got to get rid of carbon dioxide, and that's the only way that works. So less carbon dioxide must be good. More oxygen must be good. Okay, the problem is we need a certain amount of carbon dioxide flowing around in our bloodstream in the alveoli of our lungs to trigger the release of that oxygen from the hemoglobin, okay? If we don't have enough carbon dioxide, body's going to think we're cool, and it's going to hang on to that oxygen and not release it to your cells. So really, it's like you need a certain amount of it, okay? It's not an end-all horrible thing, right? The problem is when we're breathing through our mouths, okay, we are building up more oxygen and not getting out. We're inhaling, okay? We're not able to get that air out, and we stay hyperoxygenated, and we're not getting enough carbon dioxide built up to trigger the release of that oxygen into our bloodstream, okay? This is why there's that fatigue, general fatigue during the day, maybe waking up unrested, okay? So carbon dioxide maintains the pH in our blood, okay? It relaxes those smooth muscles of the blood vessels, again, right? Opening those blood vessels, that's what we need. That's why this mouth breathing is so linked to cardiovascular problems. Okay, I talked about how it's a catalyst to release the oxygen from our hemoglobin. They even have found recently, there's a recent study that I can even attach if anybody wants to see that, okay, about carbon dioxide interacting with signals in a protein that's found in our brain, skin, inner ear, liver, and uterus. Okay, so if we're not getting enough carbon dioxide, some of those organs may be a detriment from that, okay? When we mouth breathe, we are over breathing. Less carbon dioxide builds up and enters our alveoli, which sounds like it would be bad. We need a certain amount. So specifically, the body requires about 5% carbon dioxide to oxygen. Okay, the air in the atmosphere has about 0.03%. So we have to build it internally somehow to get enough to trigger all that oxygen to be released into our bloodstream. Make sense? Okay. All right. Let me see. Yes, so when carbon dioxide diminishes, it increases. There's a physical bond of that hemoglobin and that oxygen, and it will not allow it to release into your system. All right, so we had a lot of you, I don't know how many of you are watching right now that showed up on the clenchers. Okay, I'm a clencher. Listen, I didn't realize I was a clencher. My dentist was like, your front teeth are kind of loose. I was like, whoa, and she went to look at it, and she's like, you must clench. And I was biting my teeth so much at night that it was like loosening my front teeth. Okay, I was like, whoa. Okay. And I said, I got to figure out, I know what to do. I know how to fix this. But in the meantime, let's get me something to help me with that at night. Okay. But I'm a clencher. It can be triggered from stress. Okay. But it is also triggered by an airway restriction, like we were just talking about. Okay. Remember that airway affects the alignment, okay, of our jaw. We clench because we are seeking sensation out of particularly we should be feeling our first 2 molars contact. If our brain doesn't sense enough of that, we are going to find it. We are going to clench. Guys, when we clench in the middle of the night, it's like 6 times the force that comes through when we're chewing. It's massive amount of force. It's why your jaws might hurt, your teeth are going to wear down, all of those things, headaches that might come with it, neck pain that might come with it. Okay, but it all circles back still to an airway issue. Okay, when we inhale, there's a little bit of expansion that should occur in our cranium. When we exhale, there's a little bit of compression, narrowing of that cranium. Remember the asymmetries we talked about? We breathe asymmetrically, okay? So we can get a little asymmetrical opening and closing of that cranium. You may notice it in some people, their faces look a little asymmetrical. Okay, but what happens is if we have a restriction in one side or both sides to actually fill and expand that jaw, it's going to change your palate and the way your jaw sits and the way your bite is. Okay, and then at night you're going to try to be finding it. Make sense? Okay, so this is why I felt drawn to tell people there's so much of this going on and people don't realize, well, my snoring's annoying. My mouth is a little dry. My teeth are, you don't realize the whole systemic problem that could be going on. So here's what I would do. If any of you, first of all, if you can work on your airway, opening, full expansion of the lungs, and that I'm going to show you, I'm going to have exercises, right? I'm going to give you a couple of exercises that can help you to get that cranium moving, okay, as well with your inhalation and exhalation, okay? Help us with a little bit of alignment going on here at the upper neck and the skull, okay? And I'm also going to give you on the same hand ways to help you expand your breathing during the day. If you do it during the day, it will start to carry over at night. If you're not breathing well, filling to your max potential of all your airways, you're certainly going to have a hard time doing it at night. Make sense? So the first line of defense would be, do you know there's a why you can't breathe in through your nose? I mean, have you had a trauma? Do we know there's something that's going on? Like, you want to get that addressed, okay? Most of the time, those things don't require surgery or something like that. Occasionally, they do. But if you have a physical restriction of breathing in your nose, it needs to be taken care of. Okay. Sometimes it's structural, sometimes it's functional, and that's what I want you to work on is the functional restrictions to your nasal airway and all of your airways, and see where that takes you. Okay, so I will give you a handful of those things to work on. There's a lot of ways that we can have, there's a lot of causes for this. Okay, so if you have any specific questions, please, we can maybe talk that out together. But I will in general give you some of these good cranial opening, airway opening, jaw positioning activities, right? Probably going to involve a balloon. Right? You guys probably understand that. So that's one line of defense. So the second is just be aware. Keep your lips sealed during the day. Tongue should rest on the roof of your mouth. Okay, your tongue attaches to the bottom of this jaw, right? Attaches to the top of this jaw, really the bottom of it, right? So the mobility of your tongue, okay? One person in here I know had a tongue tie. My son had a tongue tie. I was like, you better fix that. Because I knew if he could not move his tongue freely, we were going to have problems, okay? And they start here and then they become systemic, right? So making sure during the day, lip sealed, tongue on the roof of your mouth. That should be your resting position. So awareness is number 1. Working on some exercises is number 2, okay? Another thing, you're going to think this is crazy. we do this sometimes. We will recommend this to clients. I will recommend it sometimes. Tape your mouth shut at night. It may very well be that it's a habit more so, or that will help you keep that jaw forward. Maybe it's just a lazy, like your muscles, because you lay on your back, just gravity brings your jaw back. We could do that. Tape your mouth shut. Okay, spouses will love that. I'm going to tape my mouth shut. I'm going to tape your mouth shut. Okay, but you're going to say you could potentially be saving their health. Okay, so that's another trick. But if those are like impossible for you, there needs to be something else done. Okay, sometimes there is an amazing method out there for helping with sleep and airway with the tongue. Okay, has anybody ever heard of myofunctional therapists? Myofunctional therapists, okay, they focus on you getting your tongue functioning in a way that opens your airway. Make sure you're not restricting your own airway with your tongue. You'd be amazed at how many of you can't stick your tongue out far enough, can't get it up on the roof of your mouth, can't move it side to side evenly. Okay, those are some other things you can do. You can keep your lips sealed, bring that tongue on the roof of your mouth, like right behind one side of your molars, and let it just touch every inside of every tooth all the way around to the other side, and bring that tongue all the way around. That's a jaw airway activity. Okay, paying more attention to that left side, which is going to need it most. Maybe even chew food more on the left side of your body because it's going to need it a little more. Okay, so the key is, there is also a very special type of dentistry out there that can help you if you need to have something to help you move and open that cranium a little bit, realign your bite. The problem is a lot of dentists are trying to move your teeth, and they're not really understanding the fact, they're not really appreciating the airway fact and the palate as far as your part of your cranium. Okay, they're not really treating it from that perspective. They're just trying to move teeth, and that can sometimes create even more of a problem. So what I'm saying to you is, I'm going to give you some activities. Try being cognizant of it. Tape your mouth shut. Give it a try. And if you're really struggling and you feel like there's something more going on that's obstructing your airway, get it looked at. And I don't have all the answers. I don't have all the tools, but I have a lot of resources. I have a lot of people. I have the dental side of people. I have a lot of these airway people, myofunctional therapists. I can help you figure out like where you might need to go. Okay. But I wanted to get this out about the importance of nasal breathing and how mouth breathing is like an epidemic. I mean, when you really start looking about it and thinking about it, I don't know of many people that don't have some form of imbalance in that. So that's a lot. Hopefully that gets you guys thinking a little bit, but let me know. I'm going to give you some good exercises. They're going to be a little bit, strange. It's one of the exercises is one that I like it's hard for me to show to patients because there's a lot of steps involved, but it's because we're trying to move that jaw and that cranium. Okay. So I'll post those up here, in the next couple hours and let you get working on those. Okay. But in general, I mean, you can have this is crazy, guys. We have 5 diaphragms, essentially. We've got this one everybody knows about, right? We've got the palate, okay, which, by the way, your tongue is the biggest orthotic for your roof of your mouth. That's why it needs to be up there. It's why it's been given to us in there, okay? Okay, so we got our diaphragm here. You've got a little diaphragm here in the throat cavity. Okay, we got a diaphragm here. We got a pelvic diaphragm. Some people even call the arch of the foot a 5th diaphragm. Okay, the issue is if we've got a restriction in any one of those, it's going to affect all of them. Okay, so sometimes we're having an airway problem up here, and there's a pelvic floor mobility issue, or a respiratory diaphragm issue. Okay. So that's just another thing to consider. So what I'm going to show you is going to be a very tip of the iceberg, will help a lot of you. And then those of you that are still struggling, think that you have a bigger problem, let me help you figure out who you might need to see. Okay, because I don't want to, And if you have children, if you see anybody, that could be a really big tip. Some people don't realize that. Okay, let your children, if you see somebody's child who's like mouth breathing, you might want to be one of those people. It's like, I think you might need to get that taken care of. It's a big deal, okay, because they're still developing their bite. And it'll be hard to fix that stuff when they get older. All right. That is a lot of info. I hope I'm not missing any comments. I don't know what my deal is with that. So, anyway, chew on that. Oh, I was going to show you one more picture. I think those of you that are left watching, because of how your cranial position affects your airway, like there are muscles that attach from your skull to your airway, okay, from your, it's called your styloid. Looks like a styloid, like a stylex that you use. And so I just thought it was a really cool picture. Here we go. Okay, and so here's your cranium. This is like your temporalis muscle, your masseter muscle. Okay, but here, this guy right here is attached. That's a little. See it sticking out. There are muscles that go from there to your throat, there to your trachea. So if there's a problem with that not being in the right position, which is an airway problem, it's going to, an airway like airflow expansion problem, it's going to physically pull on those muscles and constrict that airway. Okay, and swallowing, you might notice some swallowing difficulties. There are some exercises that involve swallowing. So that was a pretty cool picture. I'm going to show you one more thing, since I've got you on here, what I mean about the cranium. Okay, so when we breathe in, okay, it's that outline. See how, so that dotted line represents like just middle of the ground, okay, in between breaths. And when we breathe in, there should be some space. Okay, it should open up and expand. And as we exhale, it becomes very narrow. So you can see how if we're having a problem breathing on one side of our body, okay, that can affect the alignment of our skull and our airway, right? So, bottom line is shut your mouth. Tape it shut. Keep your lips closed during the day. Tongue on the roof of your mouth. Try to get some deliberate work on your airway. Oh, a pillow, certain kind of pillow. I can send you some references on that too. There are some pillows. Hello, Miss Dawn. There are some pillows that can help hold your neck and cranium in a better position at night as well. Okay, not necessarily cheap. It's not a MyPillow. You know, I'm not slamming it or anything, but it's not something that you probably have seen before. So I can send you a reference on that. And then take it seriously if you're really having a problem with it. If you can't seem to fix it with what I've given you, let's try to figure out how to fix that. Okay? All right. I look forward to hearing your questions. Everybody have a good day. Bye-bye.